I actually worked in advertising in New York City for a couple years, and while I was doing that, a friend of mine died from a brain tumor, and I just got thinking that maybe I could do something more in more medicine as far as working with people. So I actually wanted to be a veterinarian, so I left New York City to start working, become a veterinarian. But then in the process of that, I got a job working at a hospital, and then said, "Oh, this is what I want to do." So I went into medical school with no other desire than to become an oncologist. What most excites me about oncology are the hematologic malignancies or the blood cancers. So I do most of leukemias, lymphomas, and multiple myelomas. So that's my research focus as well as what I enjoy treating the most. Having a large group like ourselves allows us to have a lot more services than most other cancer centers can provide. So we have a wide access to a lot of clinical trials. We've gone out of our way to make sure we have additional support services like behavioral oncology or psychology, nutrition services, financial services, social workers. So it's not just an oncologist saying, hey, you should get this chemotherapy. It's sort of a whole village in one setting to help a patient. So I think it's the access to trials, the cutting edge care, and then also this whole concept of we can do it all right here. What we're moving to now is more targeted therapy, either in pill form or what are called antibodies, which are manipulations of the immune system to not only kill the cancer cells. For years, we've always been focusing on killing the cancer cells, but the biggest change we're starting to see is not so much killing the cancer cells, but manipulating the immune system, a patient's own immune system, to kill the cancer cells. It's sort of like cops and robbers. We've always been beating up on the robbers, but we find now what we need to do is beef up the cops or the police force, the immune system, I guess. So that's probably the biggest change, particularly in blood cancer. So it's amazing. And to tell patients sometimes, well, we can't cure your cancer, but we can keep a patient going well and keep them going for such a long time. For what was once years now becomes decades. And maybe they're not living with a curable cancer, but they're treating with a treatable cancer that still provides longevity. I think the most rewarding experience is just knowing that I've gotten patients to certain, well, obviously patients I've gotten to remissions that have turned into cures is extremely satisfying. But I have to say, one of the biggest things is helping those. Sometimes I can't cure someone, but I can get them to a milestone. I can get them to the daughter's wedding, a graduation, that family reunion. So even though when I know that our back's against the wall and the chips are against us, if I can somehow get them to those life events, that's extremely satisfying.